Hey there, friends. It's Pharmacist Michael. Have you or someone you love ever been jerked awake by a terrifying nightmare? Heart racing, drenched in sweat, completely disoriented? If you've experienced PTSD-related nightmares, you know how they feel. They can turn every night into a battlefield. And here's the truth. Sleep is often one of the hardest things to reclaim for people living with PTSD. That's where Prazosin comes in, a decade-old blood pressure medication that just might help you sleep again. But does it actually work? And is it right for you? Let's dive into the science, the real-world results, and what you need to know about using Prazosin for PTSD nightmares. Prazosin isn't a new drug. It's been around since the 1970s as a treatment for high blood pressure. It belongs to a class called alpha-1 adrenergic blockers. But here's the twist. Over time, doctors noticed something fascinating. When veterans with PTSD took Prazosin for blood pressure, their nightmares started to fade. That led researchers to explore Prazosin as a targeted treatment for PTSD-related sleep disturbances, especially nightmares that feel vivid, violent, and emotionally intense. So how does a blood pressure drug help with nightmares? Let's break this down. PTSD is a condition of hyperarousal. The brain and nervous system are stuck in fight or flight mode, even during sleep. That's why PTSD dreams often feel more real than reality itself. Here's what Prazosin does. It blocks alpha-1 receptors in the brain, specifically in areas related to fear and memory processing. By calming this overactive stress response, Prazosin helps reduce the intensity and frequency of nightmares. Think of it like turning down the volume on a trauma loop that's stuck on repeat in your subconscious. People who respond to Prazosin often say their dreams become less vivid, less frightening, or stop altogether. All right, let's talk science. Several randomized controlled trials, especially in veterans, have shown that Prazosin significantly reduces trauma-related nightmares, improves sleep quality, and may even reduce daytime PTSD symptoms. One study published in the journal Biological Psychiatry found that Prazosin reduced the frequency and severity of nightmares in combat vets by nearly 50%. But here's where it gets complicated. In 2018, a large VA-funded trial didn't show statistically significant benefit across all participants. So what gives? Well, here's the nuance. Some patients respond dramatically, others not so much. It seems Prazosin works best in people with moderate to severe nightmares and high sympathetic arousal, not in every PTSD case. So, if you're waking up multiple times a night from nightmares or fight or flight panic, this med might be more likely to help you than someone with mild symptoms or primary emotional triggers. In my experience, I've seen many patients respond positively to Prazosin for nightmares. It's definitely a treatment worth considering. Now let's weigh the pros and cons, because you know I'm all about full transparency. First, the pros. It reduces nightmares in many people. It improves sleep quality. It's generally well tolerated. It's not habit-forming or addictive, and it doesn't cause sedation like sleeping pills. What about the cons? Well, it can cause low blood pressure, especially when standing. That's called orthostatic hypotension. It might cause dizziness, lightheadedness, or fainting, especially at the start. And some people get headaches or feel unusually tired, and it needs to be taken consistently and sometimes adjusted slowly. It's usually started at 1 milligram at bedtime, then slowly increased if tolerated. Let me share a quick story, because the numbers are important, but the people are what really matter. I once had a patient, let's call him John, former military, early 40s, diagnosed with PTSD after multiple deployments. He hadn't slept through the night in 5 years. Every time he closed his eyes, the same nightmare would start again. He'd wake up in full panic mode, sometimes punching walls, thinking he was back in combat. We started him on Prazosin, just 1 milligram at night. Within a week, his wife noticed he was sleeping more quietly. After a month, no nightmares. He told me, "It's the first time I felt like myself in years." Now again, not everyone has that kind of response, but for people like John, Prazosin can be a lifeline. Should everyone with PTSD take Prazosin? No. But if you're struggling with repetitive, trauma-related nightmares, waking up sweating, panicked, or exhausted, it's definitely worth asking your provider about. Prazosin is non-addictive, doesn't sedate your brain, and has a good track record in clinical practice. Just make sure you monitor your blood pressure, you start low and go slow, and you work closely with a provider who understands trauma-focused care. So here's the bottom line. PTSD nightmares can steal your peace, your sleep, and your sanity. But for many people, Prazosin offers real relief without the baggage of sedation, dependence, or fogginess. Is it perfect? No. Is it for everyone? Also, no. But in the right patient, at the right dose, it can be a powerful part of the healing process. So if this sounds like you or someone you care about, talk to your provider. Ask about Prazosin. It might be the missing piece to help you finally rest again. If this video helped you, give it a thumbs up and share it with someone you care about. Have you tried Prazosin, or are you considering it? Drop your story or questions in the comments. I read every one. And don't forget to subscribe for more pharmacist-approved videos on medications, mental health, and natural wellness. Until next time, I'm Pharmacist Michael. Be happy, be healthy, and sleep well.